I'd appreciate.
Well, I think the concept of healing presence in general speaks to the idea that the quality of certain people to perhaps inspire self-healing in others. And actually, if you look at the span of how this term's used, it probably goes from bedside manner in conventional medicine all the way into some spiritual traditions where there's actually a transference of energy. So somebody is essentially healing somebody else. I think that most of the way we use it here, and somewhere that falls a little bit in the middle, is the idea of that in some way, shape, or form, the way you are as a practitioner can inspire other people to make lifestyle changes, or it stimulates some sense of meaning within the context of that healing environment that actually leads to self-healing from the individual. So in some ways, what we're talking about with the idea of a healing presence is, well, I think one way to think about it would be a way of, as a practitioner, maximizing the specific effects of your treatment. So you're in there doing acupuncture or giving herbs or giving nutrition or doing yoga therapy, but with a certain healing presence, you're going to maximize that effect and you're going to get more of what might be called a non-specific effect because the person generates a sense of, there's a meaning that is generated in that relationship. And some of this comes from the way people physically are in the room, but also comes from ways of being and interacting. And I think that a lot of what we emphasize here is that interpersonal interaction piece with qualities such as empathy and active listening and deep caring and really getting to know and understand the person's perspective and what outcomes they are meaningful to them, and then helping work as a team towards sort of navigating that change. I'd say one thing that's central to MUIH is the idea that words are medicine. And if we go back to the old...
Say that again. Words are
medicine. Words can be medicine, and words can also be poison. I think we all know that, right, from our own life experience. And the Greeks used to say, right, first the word, then the herb, then the knife. And the idea that the word is perhaps the first part in a healing. And one of the things that I learned... actually from Tom Ballas, who was an instructor here, and he'd taken it from somewhere else, I believe. But the idea of language being generative, not just descriptive. That when we speak, we're not just describing the world around us, we're actually generating the world around us. So to say we're actually bringing forth our world, both individually and together. And so I think in our healing presence work, that's what a lot of what we're trying to do is bring forth a world for that patient, and with us together as a working team that will maximize healing.